It's 11 a.m., so we'll get started with today's webinar. War on Poverty: Is the American Rescue Plan Act a game changer for Tennessee? So as other people are joining right now, we'll go over a few housekeeping things. So today's webinar will be about an hour and a half or 90 minutes. We're asked that you would submit your questions using the question and answer feature in Zoom. We will distribute the slides to all the attendees by May 6th, okay? And then same thing for CLEs and CEUs if you requested them. And then a couple of other things. We do have some upcoming events addressing childhood mental health crisis will be coming up. That's part one. Will be on May 11th. And then we're going to do a virtual conference all about kids, which is going to be starting on May 20th. You don't want to miss that. You can go to our website at tnjustice.org and view all of our upcoming trainings that we have going on. So a little bit about today's presenters. So my name is Rob Watkins. I'm one of the staff attorneys here at the TJC. I'll be hosting today's event as well as presenting. I also have with me Emily Sherwood, who does a lot of work with nutrition. She's a nutrition advocate here at the TJC. We have Kanika Young, the Senior Director of Health Policy and Advocacy. We'll be talking to us a lot about Medicaid expansion towards the end of this presentation. And then Laura Revelinsky, who's a Warfield Fellow and also staff attorney at the TJC. So if you're unfamiliar with the TJC, we're a 501c3 nonprofit public interest law firm. We use individual cases really to identify systemic risks to the state's safety net programs. And then we're going to advocate for change through legislative action, class action litigation, and individual client representation. At the end of the day, we strive to help all Tennesseans so we can make the state a better place. And so it works really for everyone. A little bit about today's agenda. There's been a lot of legislation that's been passed in the last year to deal with COVID-19, the pandemic that's going on. So today we're going to talk about the financial benefits, and then we're going to talk about healthcare. What are the changes that have gone on there, and what are the added benefits that people can access? We'll also talk about nutrition benefits, and then also options available for Tennessee. What do our legislators really kind of need to do so that we can claim some of these added benefits the federal government's making available? And then we're going to have a question and answer session at the end. So let's go ahead and get started. The first thing we're going to talk about are financial benefits. And as a little bit of an overview, there have really been 4 key acts that have been passed during the pandemic to really kind of help everyone kind of deal with the impact from a healthcare perspective and as well as a financial perspective. All of these acts build upon one another. So it kind of really started with the coronavirus, Families First Coronavirus Relief Act, then it was the CARES Act. Those two were kind of passed in tandem. There was an Appropriations Act that was done at the end of really at the end of the year and signed into law in January. And then of course we have the American Rescue Plan Act. These are going to provide a whole host of benefits. So for the public, it's going to be expanded unemployment, direct cash payments to individuals, nutrition, and then as well as housing assistance. And for the states, it's really going to be a lot of extra funding for these programs and then actual flexibility to expand services in certain areas. So let's talk about what it really does for the states quickly. These acts really increased things like the federal Medicaid match, and as well as providing incentive to expand Medicaid, extra money for home and community-based services, postpartum coverage, and then a mobile crisis intervention services. So basically, whenever the federal government's added or provided money to the states, it came with strings attached. So for example, under the federal Medicaid match, states are not allowed to terminate people or reduce benefits. during the period of the public health emergency, which, by the way, is extended for 90 days at a time, although the Biden administration indicated it was highly unlikely that the pandemic, the public health emergency would end before the end of 2021. So chances are it's going to continue to get renewed every 90 days. It also requires states to take action to claim certain benefits. So expanded postpartum coverage, Medicaid expansion. These are things that our state legislature has to do in order for us to claim those added benefits. And then for some of the other benefits that are out there, the state has to administrate the program. They have to create the program and the rules. A lot of that goes hand in hand, for example, with the housing assistance and nutrition that's available. But what we really want to talk today are going to be some of the benefits to families, the people that you actually serve, and the advocates that if you intersect with this constituency base, these are the things that you're going to really want to know, because in our opinion at the TJC, this is really a game changer. So there are direct cash payments. So expanded unemployment benefits, that's money in the people's pockets. There were 3 rounds of economic impact payments. Those were direct payments to individuals to spend any way that you would like. And then there are new fully refundable tax credits. So it's going to be really, really important. And if you don't take anything away from today's training other than this point, we'll consider it a victory. You want to encourage everyone to file taxes in 2020, even if they're not required to do so. This year, the filing day has been extended until May 17th. However, even if it's late, we're still going to recommend people to file. And when they file, it's important they include their bank account information. And that's important because this is the main conduit that the US Treasury has to actually put money into people's hands. And by having a bank account linked to a tax record, it's fairly quick, and it's really going to be the fastest way for people to get that money. So when it comes to unemployment benefits, there were actually 3 types that all this legislation kind of pulled together. It created pandemic unemployment compensation, and that's really that added $600, which is now at $300. That's that unemployment supplement, that added payment that people get. There's also pandemic emergency unemployment compensation. This provides funding to extend the time frame that a person's actually able to draw unemployment. So kind of keep in mind, not everybody lost their job at the beginning of the pandemic. There were some people that were already unemployed. And so what could happen is they could actually exhaust all their state unemployment benefit really before the pandemic was over. And so what this does is really kind of provide protection to those individuals. It also created kind of a new coverage group and under the pandemic unemployment assistance. And this is for individuals who would not ordinarily qualify for state unemployment benefits. So think of the self-employed, independent contractors, part-time workers. This was designed to help these people who before really had no access to unemployment. So what ARPA did is it came along and it really kind of built upon the other acts and extended it. So the pandemic unemployment compensation, it keeps that $300 supplement going, and that's been extended through September 6th of this year. The pandemic emergency unemployment compensation, you remember this is the length of time that somebody can be on it. That was expanded from 24 weeks to 53 weeks, but that will conclude on September 6th, okay, as well. So it's going to allow people added time to stay on the program. Then the pandemic unemployment assistance, this has been extended from 50 weeks to 79 weeks, and again, up until September 6th. Now, one thing that ARPA did do that none of the other acts did is that deals with the taxation of the unemployment benefit. Because unemployment benefits replace lost wages, they are taxable. So what they did with ARPA, and because it got passed a little bit later on, and some people had already ended up paying their taxes for 2020, but it exempts the first $10,200 for an individual. So those benefits are not subject to federal income tax for 2020, so long as the household income is below $150,000. So chances are it's going to cover most of the people that you're going to help. Now, here's the key point. If they have filed taxes already and and they didn't exclude that 10,200, they do not have to file an amended return. U.S. Treasury is going to go in and go ahead and update those records to reflect the exclusion of that 10,200. And if that results in a tax refund, then that refund will then also be deposited into the person's account if they've opted for direct deposit. Let's talk about economic impact payments. So there were 3 rounds of benefits. So the initial one, individuals received $1,200 plus $500 for each qualifying child. For round 2, it was $600 plus $600 for each dependent child under the age of 18 living in the home. And then the most recent one, which was round 3, which is $1,400 for individuals and $1,400 for each qualifying dependent. And that was expanded. So one of the things I want to point out with each of these 3 rounds is that the dollar amount that a child can receive goes up. So from $500 to $600 and then also to $1,400. Also notice that the ages have changed. So it used to be for that first round, it was all tied to the child tax credit. And that was for children under the age of 17. Then round 2, it was increased to 18. As you see for round 3, it's going to be not only children, but qualifying dependents. So that's really kind of more of a tax term. It's going to be real important that for economics rounds 1 and 2, those payments have already been sent. So if they haven't received those or didn't receive the full amount, they're going to be required to file a tax return. So that brings us to actual tax credits, okay? And this is something relatively new. Once again, one of the reasons why it's going to be really, really important for people to file. So there are 3 tax credits that can really help individuals. It's the recovery rebate credit. So these are the credits that if somebody either didn't get their payment for the economic impact payments 1 or 2, or maybe they just got it for themselves or their spouse, but they didn't get it for a qualifying child, then they're going to want to file a tax return and then they can claim this credit. The other one is the earned income tax credit. This one can kind of be confusing to individuals, but it's also the most overlooked. And ARPA came in and did a lot of changes to the earned income tax credit and made it a lot easier for people to qualify, and they made it a lot more generous. And then we also have the child tax credit, which is probably the biggest credit of all, affecting families, families with children under the age of 18. All of these now are fully refundable. That means if you don't owe taxes, then you're going to get money back in the form of a refund. That credit converts to a refund. So let's talk about the recovery rebate credits first. So once again, I mentioned if they haven't received economic impact payment number 1 or number 2, or if they didn't get it for a qualifying child, okay? It's important that they're going to, as I mentioned, they have to claim a credit, you have to file taxes, so they want to make sure they file a return for 2020, and then also include the bank account information so that money can be directly deposited into their account. Economic impact payment number 3, that's still in distribution. I would imagine what's going to happen if there are some errors around that, that's credit you're going to be able to claim when you file taxes in 2021, which normally we will do from January through April of 2022. The earned income tax credit, as I indicated, IRS reports that 20% of the people overlooked this one. ARPA greatly expanded it and made that maximum credit for people without children and increased it from $543 to $1,500. So quite a bit of increase there. And that's why it's important for everybody to file taxes, not just people with kids. All right, so they can claim this credit. It also makes the age it changes some of the age limits that are available, lowers it to 19 and makes it available for people over the age of 64 if they have earned income. The important thing here is that you can get free help with filing taxes, and I'm going to go over that a little bit later. There's also free software that's available that the IRS makes available to people to use. So most tax professionals or tax software will catch and be able to apply the earned income tax credit. Once again, it's fully refundable for 2021. Now the tax and child tax credit, this is probably the biggest one, and it's really a big deal. What it does is it's really kind of geared to reduce child poverty by as much as 50%. And for 2021 only, although there's a lot of talk about expanding this for future years, it expands the eligibility of kids to people under the age of 18, so it picks up an added year of coverage. But what it really does is expand the amount of the credit. So for children under 6 years of age, it's $3,600 per child. For children 6 to 18, it's $3,000. So up to their 18th birthday, they would get $3,000 per child. This is a substantial increase. Before, the maximum credit was $2,000 and it wasn't fully refundable. Now it is. However, as with all tax credits, you must file a 2020 tax return. That's very, very important. There's a lot of people out there that aren't required to file taxes. Maybe they don't have any income, or they're only living on Social Security or SSI, but they have children in their home. It's going to be important for them to file a tax return even though they don't have to. What's really nice about this credit is it's what we call an advanced credit. And this really means that you're going to be able to get up to half of the credit you're entitled to early. So you don't have to wait to file taxes for 2021 in order to claim the credit. So the way it's going to work is the U.S. Treasury, if it has your direct deposit information and it knows, because you filed taxes, who your dependents are, if they're going to meet the child tax credit, they're going to start depositing half of the credit you'd be entitled to in equal monthly payments starting as early as July. So for example, if I'm eligible to get a $3,000 tax credit for a child, let's say the child's 8 years old, okay, so I get $3,000. That means I could claim $1,500 of it early, and that would mean $250, it's assuming it's up and running in July, for each month, July, August, September, October, November, December. So you can imagine for struggling families, this is a big deal. It's $250 cash straight into their bank account. At the end of 2021, when they file taxes for 2022, they can claim the other half of the credit. So then they'll also get a tax refund or will be applied against any tax liability they may have. Okay, so it's really a big deal. That's why we're encouraging people to file taxes for 2020, even if they're not eligible, even if the deadline is passed. It's really important to get it in there because it's the easiest and fastest way U.S. Treasury is going to get that money to you. So that's my practice tip. If you haven't figured it out, encourage everybody to file taxes. It's so important. And when they do so, link it so there's a direct deposit. That's the fastest way people are going to get funds. And then in the handout that was distributed, there are a lot of free resources available to help people when it comes to filing taxes. There's a volunteer income tax assistance program that's available. There's also maybe some other nonprofits that you may be aware of that you want to share with your constituency that can help with tax preparation, as well as Legal Aid Society typically offers free tax clinics. So don't let somebody be discouraged by saying, wow, taxes are complicated. I really don't know if I can do it. Direct them so that they can get help, because it's really a game changer. But that's not all. There's also some assistance for housing. So there's a homeowner assistance fund. ARPA actually put $10 billion into that to help prevent foreclosures. And then there's an emergency rental and utility assistance, ERA. And so once again, this is more money that's been put into this, given to the states to help with not only rent payments, but also utility bills. Okay, now you also see on this slide, there is a link to the rental portal where you can go to the state's website and you can start the process for applying for relief. Now, ARPA added $20 billion for emergency rental assistance and $10 billion for homeowner assistance. So these are new funds coming into the system. They've also expanded LIHEAP, so the Low Income Home Energy Assistance Program. And this is a grant program, and it typically runs out of money relatively quick. But with all the different acts for COVID-19, pandemic relief, a lot more money has been added to LIHEAP. So the key takeaway here is you want to encourage your constituency to definitely apply for LIHEAP. And to do that, they need to go to their local county of residence, and they got to apply through someone who's authorizing the program to do LIHEAP. So do it early. Do it before it gets really hot and people start thinking about it, or when it gets really cold in the winter. This could be a game changer for a lot of people. Then there's emergency broadband benefit. So we learned from the pandemic that you have to rely on Zoom for a lot of things, whether it's for work or whether it's for educational purposes. And it's key that you actually have broadband, right? So there was money from the prior acts that really helped with the building of the infrastructure. So that would have really went money to the providers so that they could build out and really make internet more accessible in rural areas. But with ARPA, they also created an emergency broadband benefit. And this benefit's available to consumers, okay? And it's going to be administered by the Federal Communication Commission. And it provides up to $50 a month credit or help towards their internet broadband service. There is a list of participating providers. So we've also included that link that you'll see in the slide. You want to go check with that. I would also encourage anybody that has broadband working with their constituency also to check with their provider. There might be a private assistance available as well. So that really kind of brings us through everything that we have for the financial benefits. And now I'm going to turn it over to my colleague, Laura, to talk about the healthcare benefits of ARPA.
Hi, everyone. Can you all hear me okay? I'm going to take that as a yes. Yes, my name is Laura Revelinsky, and I'm the Warfield Legal Fellow at TJC. And as Rob said, I'm going to talk about the provisions of ARPA that implicate different healthcare programs and an overview of how that would affect Tennessee. Okay, just an overview of what we're going to go over. First, I'm going to talk about the provisions related to Medicaid or CHIP, which in Tennessee are known as TennCare and CoverKids. There's an incentive to expand Medicaid. There's a provision related to postpartum coverage, one related to COVID-19 testing, vaccines, and treatment, and one related to home and community-based services. Next, I'll talk about the Affordable Care Act, commonly known as Obamacare. There's a provision pertaining to premium tax credits and expanding those, and then a special enrollment period for the marketplace. Then I'll talk about COBRA and some premium subsidies under ARPA, and then finally how the different income benefits are treated as income for Medicaid and CHIP. So first, ARPA incentivizes states that have not already expanded Medicaid to do so. Tennessee is one of the states that have not expanded Medicaid. So before ARPA, under the Affordable Care Act, the federal government would have already covered 90% of the costs to expand Medicaid, but ARPA has introduced additional funding. So if Tennessee were to expand Medicaid now, they would have access to that additional funding to cover the cost of expansion. And later in the presentation, Kanika will go over what that funding would look like and what it could be used for. But for now, just as an overview, ARPA increases the funding that states that choose to expand Medicaid now would be able to get. And if Tennessee were to expand Medicaid, that additional funding would begin the first calendar quarter after the expansion starts, and it would go for 8 consecutive quarters However, the funding would stop if TennCare undid the expansion. If they stopped covering the expansion, population would no longer receive the additional funding. So they wouldn't be able to expand Medicaid for 1 or 2 quarters and then end the expansion and still receive the funding. They would have to maintain the expansion for the entire 8 quarters to keep receiving that additional funding. And just as a refresher, in case you're not familiar with Medicaid expansion, it means offering Medicaid to anyone who is 64 years old or younger, whose income is below 138% of the federal poverty line. And like I said, Tennessee has not expanded Medicaid. So to be eligible for TennCare, you have to be both below an income limit and in an eligible category. Some of the eligible categories are children and their caretaker relatives or parents, women who are pregnant, people who are receiving SSI benefits, and then some other categories for people who used to receive SSI, but for certain reasons no longer receive it. So if Tennessee were to expand Medicaid, you wouldn't necessarily have to meet one of those eligibility categories. It would be based on your income. And also, you may be familiar with the maintenance of effort requirement under the earlier COVID-19 relief laws. The Families First Coronavirus Response Act back in March of 2020 increased the funding for Medicaid in all states, regardless of whether or not they had expanded. So under ARPA, there is an additional funding for states that choose to expand now, but Tennessee is already receiving increased funding for Medicaid, even though they have not yet expanded. And the requirements to receive those additional funds from the earlier statute were that states could not impose tougher eligibility requirements than they'd already had. States had to expend all disenrollment unless someone voluntarily disenrolled. And the state had to cover COVID testing, vaccines, and treatment for Medicaid enrollees. And TennCare has paused termination since March 18th. I'll get into a little bit later a new transition option that TennCare has. But for the time being, TennCare has not been terminating anyone, or not supposed to have been terminating anyone unless they voluntarily disenroll. And in April of 2021, some guidance came out from CMS pursuant to, or in November 2020, CMS issued guidance that in April of 2021, Medicaid programs could start transitioning people who are in certain Medicaid categories, but no longer eligible for those particular categories, but eligible for another one. And I have kind of a breakdown here. For example, if someone is enrolled in Medicaid, no longer eligible for Medicaid, but is eligible for a Medicare savings program, which is for people who receive Medicare, and it covers additional costs and expenses that Medicare usually doesn't cover. So if you're currently enrolled, but no longer eligible for Medicaid, but you are eligible for an MSP, you might be transitioned to that other category. And here's a list of the different categories that you could get moved between. But if you're just not eligible, period, anymore for any program, you're not going to be terminated outright. It's only that people are being transitioned between these different categories. And under ARPA, it's easier now for states to extend postpartum coverage under both TennCare and CoverKids, which is what CHIP is known as in Tennessee. Currently, people can receive 60 days postpartum coverage under TennCare CoverKids, but under ARPA, states now have the option to extend that to 12 months. The state has to elect that option, has to affirmatively choose to do so. And that option opens up on April 1st, 2022, which seems like a really long time away, but currently people who are enrolled in TennCare and CoverKids are retaining their coverage because of the maintenance of effort requirement. They can't be terminated involuntarily. And the option will be available for 5 years after it's elected. And if the state does extend coverage from 60 days to 12 months, it has to be the same level of coverage that a person would have received under the original 60 days. And later in the presentation, Kanika will talk about what that would look like in Tennessee and what process that would require. And as I said, ARPA requires states to cover COVID testing, vaccines, and treatment with no cost sharing for anyone enrolled in a Medicaid or CHIP program. That also includes people who are enrolled in kind of a narrow eligibility category, like someone who is receiving treatment for breast or cervical cancer. They have full coverage for COVID testing, vaccines, and treatment. And there's also a provision in ARPA that provides additional funding for home and community-based services. You might see that written as HCBS. And this program is known as Choices in Tennessee. Someone can apply for Choices, and if they demonstrate a certain level of need with help for daily activities, they can qualify for either a caregiver in the home or to be placed in an assisted living facility or a nursing facility, just based on the level of need that they have with regard to activities of daily living. If a state receives this funding, it would go through March of 2022. There are some requirements for a state to be able to receive the additional funding. They have to first implement one or more activities that would enhance, expand, or strengthen HCBS. And any funds that they receive under this provision have to supplement existing funds that are allocated for HCBS. It can't supplant any funds that the state would have otherwise used. And now moving on to the Affordable Care Act. As I mentioned, you may commonly know this statute as Obamacare. It is the law that established the healthcare.gov marketplace, where people can sign up for health insurance plans online or over the phone through the federal marketplace or through a state-sponsored marketplace. So under ARPA, any individual who receives unemployment insurance in 2021 can qualify for what's called a premium tax credit. And I'll explain a little bit about that later. But the main takeaway is that a person who receives unemployment insurance in 2021 is essentially deemed as though their income is between 100 and 133% of the federal poverty line, because any household income that goes above 133% is going to be disregarded. That's for anyone who receives unemployment insurance in 2021. And you'll see later in the slideshow, but that's a big deal because that essentially means that they qualify to pay zero premiums for a marketplace plan. Usually that would only apply to people whose income is between 100 and 400% of the federal poverty line. But ARPA not only gives this added benefit to people who receive unemployment insurance, but they also extend a premium tax credit to people whose income is above 400% for the first time. The statute also eliminates a requirement to pay back any excess premium tax credit that was received in 2020. For a while, it was not clear how this was going to affect people who had already filed their tax return, because usually what happens is when you file your tax return, if it's decided that in the previous year you received too much in the tax credit, you may have to pay some of it back. But under ARPA for the year 2020, no one who received too much premium tax credit had to pay that back. But of course, ARPA was enacted after a lot of people had already filed their taxes for the year 2020. So at first it was not clear how that was going to affect people, but the IRS has posted guidance on their website for what people who had already filed their taxes for 2020 should do. And if anybody needs that link, I can send it out. So this chart might look like gibberish at first, but it is how the premium tax credit is calculated for people based on their income range. This column that says current law is essentially the guidelines under the Affordable Care Act. And then the column that says ARPA is now what the percentage is under ARPA. So you can see 100 to 133% and 133 to 150% under ARPA. 0% of your income has to be paid in premiums. What that means is that you report kind of what you predict your income is going to be for the year when you're signing up for a marketplace plan, and they'll calculate what your premium tax credit would likely be. So you can receive it as an advanced tax credit in the sense that you pay less in premiums, or when you file your taxes later, if you had a marketplace plan, you can get a refund if you were eligible for a premium tax credit. So if your income is between 100 and 150% under ARPA, you qualify for a full premium tax credit and don't have to pay premiums for a marketplace plan. And you see at the bottom where it says over 400%, under the Affordable Care Act, that this just did not apply. You were not eligible for a premium tax credit, but under ARPA, you are eligible and should only have to pay up to 8.5% for your healthcare premiums for a marketplace plan. Also, a major provision is that the Affordable Care Act usually only opens up enrollment for the federal marketplace from November 1st to December 15th. So in a typical year, if you don't have health insurance and you want to enroll in a marketplace plan, normally open enrollment is only from November 1st to December 15th. And if you fall outside of that time frame and you need to sign up for a healthcare plan, you need to fall into what's called a special enrollment period. And reasons for being eligible for a special enrollment period can be things like you lost a job that offered health insurance, you turn 26 and you're no longer on your parents' health insurance program, you relocated to a state and now you need a new healthcare plan. But currently healthcare.gov is open and allowing people to enroll in a marketplace plan, even if they would not normally fall into a special enrollment period until August 15th. So it's essentially a special open enrollment period until August 15th of this year. And next, there are some provisions related to COBRA for people who lost their job but want to keep their healthcare coverage. For anyone who loses their job between April 1st and April 30th of 2021, and who then enrolls in COBRA coverage, ARPA fully subsidizes their premiums. And they also created a 60-day window for people who sort of missed this and lost their job before this went into effect. So say if you lost your job in March of 2021, and so the 18-month eligibility period is still going on when you could be in a COBRA plan, but when you lost your job, you elected not to enroll because you couldn't afford the premiums. Now you have a 60-day window to re-enroll and get the subsidized premium. But it can only be if you're still within that 18-month eligibility period. This does not extend the eligibility. It only means that you have kind of a second shot to sign up and have your premium subsidized. And this chart kind of explains the different benefits that we've gone over, the different tax credits, and how they are factored into your income for the Affordable Care Act and for TennCare or CoverKids. So your base unemployment benefits that you receive from the state if you are eligible for unemployment benefits, they are included as income for both Medicaid and in calculating your eligibility for a premium tax credit. The supplemental unemployment benefits are not counted as income for TennCare and CoverKids, and they are counted as income for the premium tax credit, but anything above 133% is going to be disregarded. The economic impact payments or stimulus payments are not counted as income for either Medicaid or the premium tax credit. And then the tax credits that Rob went over earlier are excluded as income. So you don't need to calculate them as part of your income for either Medicaid or the premium tax credit. So now I'm going to turn it over to Emily Sherwood to talk about the nutrition programs and how they're affected by ARPA.
Thanks, Laura. Can everyone hear me okay? Okay, good. My name is Emily. I'm a nutrition advocate at TJC. Today, I'm going to talk about SNAP, WIC, and pandemic EBT. I'll give a brief overview of each of the programs and talk about their reach in Tennessee, and then we'll go into more of the programs and their specific provisions for ARPA. Alrighty, so starting off with WIC. WIC is the Special Supplemental Nutrition Program for women, infants, and children. This applies to moms and kids under 5. Moms can apply once they're pregnant, so the child does not have to be born for a mom to apply for WIC. And it can also apply for fathers who would like to apply on behalf of their child under 5. It provides healthy food, nutrition education, breastfeeding support, and social service referrals. There are pretty strict rules about what can be purchased with WIC. So there's different tools that they have for folks to figure out what can be purchased, online shopping, things like that. Over a quarter of Tennessee children under 5 are participating right now. So it has a pretty far reach in Tennessee. Because of the pandemic, none of the WIC offices in Tennessee are open. So everything's being done over the phone right now. So if folks want to apply or for their recertification, or if they need a referral or any nutrition or breastfeeding support, they can go ahead and call their health department for everything on WIC right now. Okay, so some provisions in ARPA for WIC. So the big one is that there was $3 billion set aside to be invested into the program. This is mostly for modernization. So like I talked about a little bit on the last slide, there are pretty strict rules about what can be purchased with WIC. So this could include improved shopping guides for families, online shopping options. So everything that they could purchase would just automatically be on the webpage, so they wouldn't have to be at the store spending extra time going back and forth from their phone and trying to figure out what they could purchase and what they couldn't. So that's one thing that we're looking forward to possible improvements on. Also an improved application process. So maybe an online application, maybe more caseworkers helping folks through the application process over the phone or in person. Some WIC offices will have mobile units. The one in Nashville did before the pandemic started. So possibly more of those, more outreach to potential WIC participants. So those are some of the things that we're looking for that $3 billion to be invested into. There isn't anything concrete written down about what is actually going to happen yet, but it should all be around the common theme of modernization, and we'll keep folks updated as we hear more on our social media channels and our newsletter, which I'll share later on. Okay, so the next program we'll talk about is SNAP. This is the Supplemental Nutrition Assistance Program. It provides a modest supplement to a grocery bill for the month that comes out to be about $1.40 a meal. So definitely not the entire grocery bill for the month, but it's just meant to be a little boost for folks. This is less restrictive as far as what folks can purchase. So once folks apply and are approved, they're sent an EBT card in the mail. It functions very similarly to a debit card. So folks can take it to the store and swipe it for things like produce, dairy, eggs, meat, things like that. Unfortunately, you can't purchase things like household cleaning products, cosmetics, pet food. If your grocery store has like a deli, you can't purchase hot prepared foods with those SNAP dollars. So it's a pretty far-reaching program in Tennessee. As of last month, over 900,000 people were participating. That's nearly 1 in 6 Tennesseans. Lots of folks on the program are coming from working households, lots of household compositions with a lot of kids, veterans, and seniors or adults with disabilities. So this is a really far-reaching program in Tennessee that's reaching a lot of different folks. But one thing to note is that since the start of the pandemic, about a year ago, we've seen food insecurity in Tennessee nearly double, and the rate of SNAP participation has not matched that increase in food insecurity. So a big thing that we're thinking about and trying to contextualize these ARPA improvements with is how can we make this SNAP participation number more reflective of the food insecurity rate in Tennessee. Okay, next slide, please. Okay, so some special provisions in ARPA for SNAP. There are a few. One was in previous COVID legislation, there was an extra 15% added on to everyone's SNAP benefit. This is regardless of income or any individual circumstance that's applied to everyone who is participating. So that 15% was due to expire at the beginning of the summer, and ARPA extended it until September with the possibility to be pushed back even farther if the state of emergency continues. So that 15% is still taking place right now. And just to kind of give you guys an example of what it's looking like on the ground for SNAP participants right now. So looking at a household size of 1 right now in Tennessee, well, last month in Tennessee, those folks would be receiving the maximum benefit amount. And this too is regardless of individual circumstance or income or anything. This would apply to everyone. So they would be receiving that max benefit. And that is from previous COVID legislation as well. And it's dependent on the state of emergency in Tennessee. So as long as that state of emergency is extended, the state has, or the state DHS office has the opportunity to apply for a waiver that allows that maximum benefit to be extended. It was in effect last month. We're still waiting to hear about this month, but it's likely that it will carry through May as well. So in May, it's likely that a one-person household will be receiving $234 from those two COVID legislation bumps to SNAP benefits. And like I said, regardless of individual circumstance. It also includes over $1 billion to states and administrative funds over 3 years. The states do not have to pay this back. This is to help with administrative problems or challenges that have come up from all of these new changes. So helping get more caseworkers in, helping with training, helping with setting up different departments to kind of push out these new programs. So that $1 billion is a big help to the states as these new changes come up. And then it also includes $25 million to the USDA. This is for researching and implementing new improvements to SNAP. So one example of that is an opportunity for SNAP online purchasing. So this $25 million would include research on that, and then the states actually pushing out that program, and then the states doing education with retailers and participants on what that will look like on the ground and how they can shift what they're doing with their current SNAP participation to match those new programs. And this has really come about, especially the online purchasing, during the pandemic for folks that don't feel comfortable or can't go to the grocery store. This is an option for them to just buy stuff online and go ahead and pick it up from the grocery store versus having to go in. Okay, next slide, please. All right, so the last program that we'll talk about today is Pandemic EBT or P-EBT. So these are benefits that replace free or reduced price school meals lost due to virtual learning. So this applies for students who were receiving those free or reduced price meals before the pandemic. They would go into school and they would get a free lunch. And because they're learning virtually now, they can't receive that food. So these are cards that are very similar to the SNAP cards. They're mailed to eligible families. We're on the third round right now, which is for October and beyond. So the two requirements for it, like I said, students have to be enrolled in free or reduced price meals through the National School Lunch Program, and they also have to be learning virtually. So that doesn't necessarily have to be learning virtually 5 days a week. They could be doing a hybrid schedule of 2 days at home and 3 days at school, but they do have to be learning virtually, at least partially, to be eligible for these round 3 benefits. It also applies for students who are attending a CEP or community eligibility provision school, which basically just means that all of the students in that school are enrolled for free or reduced price lunch automatically because enough would qualify. This program reaches over 700,000 children in Tennessee, so also a huge program for families who have been missing out on those school meals because of the pandemic. Next slide, please. Okay, so the big ARPA provision for P-EBT is that it extends it into the summer months. So definitely it is extended for this summer, the summer of 2021. There is a possibility for it to be extended into summer 2022 as well. So that will be possible if there is a state of emergency at any point during the next school year. So if there's a state of emergency in September or December or April of next year, that will automatically make summer 2022 a P-EBT summer. So the USDA has put out some guidance on what summer P-EBT should look like. So it applies very similar to school time P-EBT. It applies to children on free or reduced price lunch in the previous school year to that summer, or children who apply and get on for free or reduced price meals that summer. One important thing to note is that children do not have to be learning virtually in the last month of school to be eligible. So say in June, it's the last month of school, your child or someone's child is back learning in person, they can still be eligible for P-EBT that summer if they meet all of the other eligibility criteria. They don't have to be learning virtually that last month of school to be eligible. And also, even if a student is receiving summer meals through the summer food service program that summer or any other type of government food assistance meal program, they can still receive that summer P-EBT. So even if they're receiving a summer meal, they can still get that summer P-EBT. It also applies for children under 6 who are enrolled in SNAP. The USDA has suggested a standard benefit for all states in the continental United States of $375 for the summer. Tennessee has the option to opt into that standardized benefit or adjust it in their plan. So that's actually the next step for Tennessee, is to go ahead and write a plan based on USDA's guidance for what they would like to do for summer P-EBT. The USDA will then go ahead and take a look at that and give them feedback. And then once it's approved, Tennessee can go ahead and start rolling out those benefits to children in the state. Okay, next slide, please. All right, and then I went ahead and put in some additional resources here if folks want to read up more about it after we send the slides after, but there's a link to a USDA fact sheet that goes a little bit more in depth into all of the food assistance provisions in ARPA. There's a link to a fact sheet about what WIC modernization could mean for the program and the participants. And I also included the summer P-EBT guidance that the USDA has sent to states to help them while they write out their plan for getting those benefits out. I also included a link to sign up for our newsletter or to email me so you can stay up to date as we hear about what a lot of this funding is going to go towards, and as we advocate for things that will best help our clients navigate these programs. Thank you, everyone. And I'll go ahead and turn it over to Kanika to talk about options available to Tennessee.
Thank you, Emily. And hi, everyone. Thank you for sticking around till the end. I'm going to talk about a couple of things that have been mentioned before, but specifically our recommendations for making the best use of the new funding that's available under ARPA. Next slide. Before I go into the impact of the ARPA provisions related to the Temporary Assistance for Needy Families program, or TANF, I want to provide an overview of how the program has been going in Tennessee and really demonstrate how families living in poverty need the extra help, and they've needed it before the pandemic hit, and especially more so now. So TANF provides cash assistance to families with children through a program called Families First. And it also funds grants to nonprofits and other qualified entities to administer programs that meet the purposes of TANF through something called the 2Gen grant program. Next slide. The purposes of TANF are defined by federal statute. There are 4 core purposes. They are provide assistance to needy families so that children may be cared for in their homes or in the homes of relatives. The second purpose is end the dependence of needy families on government benefits by promoting job preparation, work, and marriage. Third is prevent and reduce the incidence of out-of-wedlock pregnancies and establish annual numerical goals for preventing and reducing the incidence of these pregnancies. And fourth is encourage the formation and maintenance of 2-parent families. These purposes were established in the 90s when the so-called welfare program was reformed, and they haven't been touched since then. So you can kind of pick up on that in the language and the focus on addressing the family unit. Next slide. So the TANF program in Tennessee received some bad press towards the end of 2019 when news broke that the state had accumulated over $730 million in unspent TANF funds that are supposed to be spent to fulfill the purposes that I just went over and address the needs of families living in poverty in our state. In response to that news, the Tennessee Justice Center worked with with the Beacon Center of Tennessee, which authored that report that revealed this large surplus, as well as the Tennessee Disability Coalition, to convene a group of stakeholders to talk about the TANF program and figure out how we could influence the state to put the money to the best use. Next slide. And so in those discussions, we worked with experts at the Center on Budget and Policy Priorities to understand how Tennessee stacks up against other states regarding the TANF program. And we learned that Tennessee TANF benefits were among the nation's lowest, as you can see here reflected with the red line showing that the Tennessee maximum TANF benefit is really in the lowest quadrant for the amount of the benefits as a percentage of the poverty line for families. Next slide. We also realized that cash assistance in Tennessee has actually fallen substantially in the past 50 years. The max benefit as a share of the federal poverty line for a family of 3 is reflected on this slide, and you can see it went from 45% in 1970 to 15% in 2020. There is legislation that's being considered by the Tennessee General Assembly as we speak that would increase the amount of cash assistance to families, but it still is not going to bring us into the highest percentage for meeting the needs of families living in poverty. Next slide. TANF benefits, just to think about it in another way, covers less than half of rent, and that's for a family of 3 with a 2-bedroom apartment. And so you can see here that particularly for Nashville, as most people know, the market is really on fire, and rent has gone really high in recent years as Nashville has become more popular. And so the money doesn't go as far when your rent is not keeping up with the increase in rental prices. Next slide. TANF's reach in Tennessee has fallen by 33 points since 2006, which is one of the largest declines in the nation. There's a few reasons for that. One is that there is a time limit that applies to the TANF program. A family can't receive benefits for more than 60 months or 5 years. And there are also different requirements, such as showing that you are working or engaged in educational programs to receive job training and that sort of thing to continue to receive your TANF benefits. As part of the stakeholder group that we convened, we talked with people who had been receiving TANF benefits and no longer were receiving them. And they talked about how hard it is to navigate the program and to stay in compliance with the various requirements that are attached to getting TANF benefits. And for some people, when you do a cost benefit analysis, the amount of money that you receive is just not worth the headache and hassle and the hoops that you have to go through to maintain your benefits. And so that adds to this declining caseload that's shown on this slide, even though we know that there are lots of families who are living below poverty who would benefit from the extra assistance. Next slide. Tennessee spends a lot less than their annual block grant allowance than other neighboring states. So Tennessee gets about $190 million a year for its TANF program in the form of a block grant. And that just means that the federal government provides this lump sum and there's flexibility for the state to spend it as they wish. And so the bill that I just mentioned that's being considered by the Tennessee General Assembly now would set the reserve at equal to 1 year of the annual allotment. So the reserve could no longer reach the high amount that it was at prior to the legislation, which was the 732 million that I mentioned before, the new reserve would have to stay at 190 million or below going forward. We're actually pleased that that is the amount that the legislators agreed upon, because we were nervous that they would try to keep that reserve amount at a much higher level to include in a so-called rainy day fund for the program. And really, we wanted to impress upon the leaders that it's raining now and people really need that money, and it shouldn't be hoarded. And so that new amount will help to make sure that the funds are spent each year. And so we expect this to improve in terms of comparing Tennessee to how other states spend their block grant. Next slide. Also, just wanting to note that Tennessee is among the 10 states with the highest child poverty rates. As you can see here, there are 10% of children are in deep poverty and 22% are in poverty as of 2018. And we're, pretty confident that these numbers have not improved in recent years in light of the pandemic and the economic challenges that it has presented for families, and really knowing that families who are already struggling were hit particularly hard by the pandemic, since those low wage jobs were among the first to be eliminated when businesses closed, and a lot of them have not resumed back to normal pre-pandemic levels. And so now is really the time to focus on addressing the child poverty rates and helping families lift out of poverty. Next slide. So that brings us to the effort that the current administration has put into addressing the needs of families living in poverty. And so the American Rescue Plan Act, as mentioned before, includes funding for pandemic emergency assistance. This emergency fund is part of the TANF program, and it's been earmarked to provide cash assistance or other services to families with low incomes. The state had until April 25th to notify the federal government that they would accept the allotment. And I have been in communication with our Department of Human Services, DHS, who have noted that they have notified HHS that they will accept that money. So that means Tennessee will be receiving its allotment of almost $13 million to provide this additional cash assistance or other services to families. The funding is available as of April 1 through September 20th of 2022. So the state needs to spend that money during that time under the ARPA provisions. Next slide. So there is a defined criteria for use of the funds, but it's still pretty flexible. It must be used to provide households with non-recurrent short-term benefits. So it can't be a recurring or ongoing payment or to meet those types of needs. It has to address a specific crisis or episode of need, and it cannot extend beyond 4 months. It can be provided as cash or in other forms of benefits, such as housing allotment or diaper banks or funds for a specific purpose. But it cannot be used to cover the cost of providing regular monthly TANF cash assistance, which is what's in place to meet those recurring and ongoing needs through the regular Families First program that I mentioned before. It also must serve, quote, needy families, but that term is not defined. Most states have used 200% of the federal poverty level as their standard for defining needy. Next slide. So some examples of permitted uses of the Pandemic Emergency Assistance Fund is to provide extra payments to TANF participants, or it could go to a broader group, and such as SNAP participants with children. Emergency housing assistance to families is a permitted use, and we believe that it would be beneficial to focus on families who had been left out of the relief that's been included in previous COVID-19 relief packages, so that they can address back rent and avoid evictions. And specifically, that would include some immigrant families who were not covered by those prior relief packages. And also it could be used to help families fleeing domestic violence, for example, to cover moving costs or to cover the initial rental payments for those survivors who are trying to reestablish themselves away from their abusers. And we know that under the safer at home orders that states have been under, lots of people have not been safer at home. And so this is really important to recognize that people have been essentially trapped with their abusers, and economics is a big reason for those situations, and people not being able to flee. And so that is an important permitted use of the funds under the Pandemic Emergency Assistance Grant. Next slide. So our recommended strategy for Tennessee's $13 million would be to direct the funds to families in deep poverty, which is defined at 50% of the federal poverty level. We think that the money could really help the families who are struggling the most. And if it were to be used for a broader population, it just wouldn't go as far if you have more people. And we also know that people who are at a higher income bracket, although they may be in need, they are more likely to swoop in and get those funds before families who are really at the lowest economic level could even find out about them. So we really want to focus efforts on making sure that those families who are at the lowest poverty level really learn about the availability of the funds and have a chance to access them before they're gone. So based on the current caseloads for TANF recipients in our state, they could receive $750 from the Pandemic Emergency Assistance Fund in the form of cash assistance. Or if we wanted to spread the funds a little broader, we could do payments of $200 and include both TANF and SNAP recipients. Our recommendation would be to distribute one payment in May and another in June, really recognizing that during these summer months, families are really in need, and they want to make sure that families have money to address things like higher than usual utility bills due to the warmer weather, or to spend money on buying back to school supplies or new clothes for kids as they're getting ready to return to school. We also recognize that cash is administratively easier than other forms of benefits, because under ARPA, if you were to do some other service with the Pandemic Emergency Assistance, you'd have to justify or document the need for that other form of assistance. So administratively, we think it would be best for the state to just send cash out to these families. Next slide. And so the next topic I just wanted to reinforce is that the postpartum coverage provision in ARPA makes it easier for states to expand coverage. On average, or the default is 60 days for postpartum coverage, but experts recognize that the recommended period is a full year postpartum, so that moms who are on TennCare CoverKids can continue to receive healthcare services after they have delivered their baby, if they're only eligible because of their pregnancy. So Tennessee does have plans to expand from the 60 days to a full year. ARPA has provided the state plan amendment option, which is an easier way for states to do this, but the state had been discussing expanding those coverage periods through through an 1115 waiver. If the state does choose to extend coverage, it has to provide the same level of coverage that the individual would receive for the original 60 days. So they can't offer reduced benefits or exclude certain services to be in compliance with this extension. Next slide. So we are pleased to find that Governor Lee's proposed budget included funds for the postpartum coverage expansion, and that budget has been approved by the legislature. And so it allocates $7 million for the expansion of postpartum coverage. The next thing that needs to happen is the state has to decide whether to pursue the ARPA option of the state plan amendment, or if they would follow the existing option of a Section 1115 waiver. The Section 1115 waiver process is more complicated because of needing to show budget neutrality to the federal government, and the process of posting the waiver for a comment period, et cetera. And so the easier pathway is to take advantage of ARPA, although that would not be available to start until April of next year. Next slide. So now on to Medicaid expansion. As Laura mentioned earlier, ARPA does include a new incentive for states that haven't yet expanded Medicaid. Tennessee is one of only 12 states in the country that have not expanded. Aside from ARPA, Tennessee could have expanded its Medicaid program known as TennCare, and the federal government would always pay 90% of the cost, with the state coming up with the other 10%. That is still the financial arrangement, although now ARPA provides additional funding that would help the state cover those 10% costs, which I'll address a little later. But prior to this additional incentive, state officials had estimated that Medicaid expansion would bring in an additional $1.4 billion in federal funds to our state economy each year to support our healthcare infrastructure. And so doing just some rough math, that means that we've missed out on about $10 billion over the years that's gone, that we didn't take advantage of because of not expanding Medicaid sooner. So each day that passes, we're missing out on more money. That would help. That additional federal funding through Medicaid expansion would provide health insurance to over 300,000 working Tennesseans who don't presently qualify for the Medicaid program. It would also create an estimated 15,000 healthcare jobs, and it would help hospitals stay open. Tennessee has the highest rate per capita of hospital closures since 2010. Texas has a larger number of hospital closures, but of course it's a larger state. So if you look at the numbers on a per capita basis, Tennessee has the highest rate. And studies have shown that states that expand Medicaid are 6 times less likely to have hospitals close. And so that is another important benefit of expanding Medicaid. Next slide. And so for the ARPA incentive for Medicaid expansion, it would provide an additional 5 percentage points to the federal funding for the state's traditional Medicaid program for 2 years. And so distinguishing the traditional Medicaid population from the expansion population, the traditional population are the ones that Laura mentioned earlier in terms of meeting the income threshold, but also fitting into one of the defined categories, that being children, pregnant women, parents or caretaker relatives, and some older adults and people with disabilities. So if you don't fit within one of those categories, the expansion would allow you to still take advantage of the Medicaid program if you're below 138% of the federal poverty level, and people who are above that level have the marketplace as an option. And so based on the estimates of this additional 5 percentage point increase for the traditional Medicaid population, that would create about $1.26 billion for 2 years in federal funds. The cost to the state, the 10% to expand Medicaid for those who don't currently qualify, is around $360 million. And so that would net the state $900 million if it were to take advantage of this ARPA incentive and go ahead and expand Medicaid. And so we are trying to educate people about this math and really encourage our leaders to not leave this money on the table, especially now because of the pandemic. And we know that more people are falling into the coverage gap because of losing their job and losing their health insurance if their employer even offered it in the first place. So in light of this growing need and in light of this new incentive, now is the time to really get serious about Medicaid expansion and make it happen. So we've included here on the slide a link to a call tool that you can use to call Governor Lee and your state senator and let them know that you support Medicaid expansion. It has a script that you can use to make this call, and don't be intimidated by calling them. The governor is not going to answer. Your senator is not going to answer. It will be a staff person, and they're not going to quiz you on your knowledge of Medicaid expansion. So you can just, state your reasons for supporting it and just make that known to them without fear of having to debate the issue. Also here, you can sign up for emails from the health policy team. We have newsletters that are segmented and focused on general healthcare advocacy, which would include Medicaid expansion and defense alerts. And we also have a list focused on children's health, as well as independence, which is for older adults and people with disabilities. So if you're interested in receiving information about any or all of those topic areas, you are welcome to sign up for emails there. And I believe that that is my last slide. So if there are any questions?
Thanks, Kanika. And actually, we do have one. It's about the postpartum expansion program. Would that include mothers on CoverKids or just moms on TennCare?
There is not a lot of detail in the announcement. As stated, it just says TennCare population. So I'm not sure if it includes CoverKids or not.
So it's something that everybody just kind of needs to keep an eye on to see, really what the details are.
Yes, absolutely. Yeah, the state has indicated that they're awaiting further guidance from CMS about the ARPA option. And so they have not decided at this point the details of the extension of the postpartum coverage, but it's definitely something that we will keep an eye on and we'll let you know. So that's another reason to sign up for the email alerts, because we'll definitely be sharing that information once it becomes available.
Okay, so we do have another one. It says, do we know where Lieutenant Governor McAnally is in his study to expand Medicaid? He has said it is worth looking at the idea now, but he also said that he wants to talk with how flexible CMS is on the issue. Do you know if other legislators are supporting this other than Senator Briggs?
Yeah, so we are aware of Lieutenant Governor McNally's recent statement about seeing a reason to take another look at Medicaid expansion. Since then, unfortunately, the House Speaker, Representative Sexton, said that it was basically a non-starter in the House. And since then, we have not heard any other discussions about where legislators stand on the issue. But we are focused on organizing people in McNally's district, his constituents in Senate District 5, as well as organizing people in Cameron Sexton's district so they can hear from their constituents about, why it's important for them to really look at this seriously and expand Medicaid. So if you or someone lives in those districts and would be willing to speak up, we definitely want to get plugged in with you.
Okay, well, thank you very much. Are there other questions? If there are, please go ahead and put them in the question and answer box in Zoom. Just in general, I'd like to toss this out to everybody that stuck around till the end, and we did have good participation for this event. What do you guys think? Do you think ARPA really is a game changer for Tennessee? You can just simply put that in the chat and let us know. We know there's a lot of financial options that are available, put cash in people's hands. We know that there's added health benefits for individuals, as well as housing, nutrition. But it also seems like we've got these opportunities now to really expand Medicaid and to help others. So what do you guys think? Do you think this is a big deal for Tennessee? Are you excited about it? Interested in hearing what your thoughts are. Okay, folks. Well, I want to thank you very much for attending today's webinar. We will be distributing the slides to everyone by May 6th. If you requested CLEs or CEUs, those are going to be made available by the 6th as well. So just as a reminder, 2 upcoming events. We've got Addressing Childhood Mental Health Crisis Part 1 coming up on the 11th. And then we have our virtual conference on All About Kids. So once again, thanks everyone for joining today. We're looking forward to seeing you on the next webinar from the Tennessee Justice Center. Have a great day.